Hey friends, do you ever do shoulder joint mobilizations? I'm going to cover this with you, a common mistake that people make with shoulder mobilizations. I'm going to cover the difference between distraction and traction. This is your Manual Therapy Thursday. I'm Dr. David. So let's cover this here. Here's the shoulder joint. Let me just move the scarf over here. When I see physical therapists doing glenohumeral joint distractions or mobilizations, really, what I typically see is a patient supine, right? Then they'll put their hand over the front of the humerus here, the proximal humerus, and just kind of stabilize the rest of the arm. You know, they usually do this thing, let me put your hand under my elbow, and then they're just leaning their weight down against the body here. And if they apply any sort of force in this direction, it's likely going to be a traction force. So traction just means that you're pulling along the length of the bone itself. What's actually necessary is distraction, which means that you're pulling the ball away from the socket, and it's actually not in line with the length of the bone here. Let me tell you why this is relevant. In joint mobilizations, in order to get an optimal joint mobilization, there needs to be as much distraction force as is needed to separate the surfaces of the joint. So if you're doing traction, because you're doing it this way, you're not really going to get much distraction at the joint, and then your joint mobilization is not going to be very effective. So what's needed is, instead of having your hands here, you have to modify like so. You're going to grab with two hands as close to the joint as possible. So one hand's going to be just off the acromion, and the other one's got to be up in the armpit. Sorry, especially in summertime, you want to go wash your hands after every patient that you deal with. But anyways, you're going to grab like this, and as much as you can, grab that humeral head, and then the force to distract has got to come from your hips and legs. So if you be essentially in the squat stance, and then you pull away, and you see how Manuela, my skeleton, went over to the side, because I'm using my body to distract that joint, not traction. Once you maintain some distraction, and the patient will literally be sliding towards the side on the table. I mean, they won't fall off the table, but they'll be pulled in that direction. Then you can apply your posterior glide, superior glide, inferior, anterior glide, or any version of a glide that you want to do, but you have to maintain that distraction. So get this clear: if you're doing traction, not good. You're not going to get the best manual therapy technique for that glenohumeral joint. You're not going to open up the joint and get the cartilage to move well and rehydrate and all the cool effects, the proprioceptive effects, all the neural effects that you're getting in there. You have to do distraction. Hey guys, if you have any questions, comment below, direct message me if you don't feel comfortable, but we love a chatter on here, so just comment below, tell me if you've been doing it wrong. No judgment whatsoever. This is not common knowledge, so don't feel bad if you've been doing it wrong. If you have another way to do it, I'd love to learn, so show us. If you can put a video up, that'd be very cool as well. Have a good day. Bye-bye.